Assalamu alaikum students. Welcome to the class today. So before starting my lecture, I just want to remind you why my topics are important because they are very precise and exam oriented. And I am covering only one topic in one video. So if you are interested in only particular topic, you can hear the topic related to it. And please like, share, and subscribe to my channel. So today we have very important topic. It is asked as a 4 marks question, quite common in your theory exam. And second thing is it is commonly asked in your PG entrance also. So we'll start with the today's case. We have a history of this photograph. I got it from farmer protest in Delhi. So there is history of hit by a cop. So here, if you see the patient is there and he was hit by a cob, he tried to resist a hit or a stick by forearm. So all force fell into the forearm. So here, when he was trying to resist, the forearm got injured. And after that, patient developed swelling and pain over the forearm, and there was restricted movement of the elbow, wrist, and the forearm. So there is some injury to the bone, which is causing alteration in the function of elbow, forearm, and wrist. So in the last class, I have told you about the ice cream diagram of four specific part of the forearm, that is proximal radial ulnar joint, distal radial ulnar joint, radius, and ulna. So if one part is affected, other three things will also get equally affected. So today we are going to discuss Monteggia and Galeazzi fracture. These are very important factor because it is quite nomenclature is quite confusing. And second thing is it is repeatedly asked in your exam. So before starting the class today, you need to know what is radio-ulnar joint complex. So if you see, this is a radio-ulnar joint complex. It is formed by proximal radio-ulnar joint, then ulna, distal radio-ulnar joint, and radius. So we have four component here. 1, 2, 3, 4. So anything affecting a single component out of this four component, all four component will have some effect, and it affects the elbow joint, wrist joint, and radial ulnar joint. So if you see the radius and ulna, if you the forearm and the joint, they form something like a two friends holding each other's hand, standing only on the leg. If you just remove this leg, all will fall down. If you just remove this one, they all will fall down. So this is how they are closely related to each other. So we have radio ulnar joint complex. We have radius, ulna, interosseous membrane, as I told, the connecting the radius and ulna. Then distal radio ulnar joint, proximal radio ulnar joint. So what is the importance of radius here? So it gives stability to varus and valgus angulation at the wrist and the elbow, and movement is of the forearm is supination and pronation. So what is Monteggia fracture? If Monteggia fracture is defined as fracture of the proximal one-third of ulna. It's a Monteggia is proximal one-third of ulna with associated radial head dislocation. So there is involvement of proximal radio ulnar joint. So it's a ulnar fracture with the dislocation of the radius, or it affects the proximal radial ulnar joint. And the common nerve to involve here is there is associated interosseous membrane injury. So we have Monteggia fracture. Monteggia fracture, as I told, there are two components. One is they affect the radial head, they affect the ulna. Ulna is affected. So radial head may be dislocated anteriorly, posteriorly, or laterally. Here, if you see it is anterior, this is lateral. So it may either dislocate anteriorly, posteriorly, or laterally. This is radial head, and it is associated with fracture of ulna. So ulna fracture may be complete, proximal ulna, or plastic deformment of ulna, or a fracture of radius and ulna also sometimes be present. Here, if you see, there is fracture of radius and ulna with radial head dislocation. Here, only the fracture of ulna is there along with the radial head dislocation. The mechanism of injury is one of the common mechanism is fall on outstretched hand. So what is the pathology here? As I told, there are two things here. One is ulna. Ulna is injured. Second is radial head is dislocated. radial head dislocation. The combination of this is Monteggia fracture. So how will you remember it? Always remember Monteggia is for mountain. Mountain means they are very high. Second thing is M for medial. So we have M, M, M. That is Monteggia fracture affect higher level. That is mountain. Mountain means proximal or high, high ulna. Then medial bone, which is the medial about among radius and ulna, it is ulna. So M for Monteggia, M for mountain, that means high. Then M for medial bone, that is ulna. So it's a combination of proximal ulnar fracture along with the radial head dislocation. This is how you need to remember the Monteggia fracture. So patient will have history of injury swelling around the elbow and arm. There is restricted elbow movement, restricted forearm movement, and wrist pain. The common nerve to get affected is posterior interosseous nerve, which gives low radial nerve palsy. Here, diagnosis is by X-ray. So one thing you need to be very particular while taking X-ray is when your patient may have obvious forearm fracture. So we should always include elbow joint and wrist joint in X-ray. Because if we won't include the wrist joint and elbow joint, we are likely to miss subtle radial head dislocation or distal ulnar dislocation in forearm injuries. So how is the treatment? As I told, we have two components here. One is radial head, second is ulna. So we need to attend to the radial head dislocation. We need to attend to the ulna fracture. So radial head dislocation, what we can do is we can either do closed reduction, we can do open reduction. And as there is injury to the annular ligament, we can go for annular ligament repair and or reconstruction of annular ligament. Whereas ulnar fracture, we can manage by closed reduction, open reduction, or we can put intramedullary nail, or we can apply the plate. Here is the X-ray where we have an intramedullary nail. So the treatment is we need to attend both. We need to look for the treatment of radial head dislocation. We need to check also for the ulnar fracture. This is how you treat the patient who have Monteggia fracture. Now we'll move on to the second common fracture, that is Galeazzi fracture. Galeazzi fracture is a fracture of distal 1/3 of the radius and associated with dislocation or subluxation of distal radio-ulnar joint. So how will you remember this one? Here, just remember a mnemonic ground. Ground means Galeazzi, which is affecting the radius. So, and ground is always lower. We have mountain, which is high. Mountain is medial bone, that is ulna. Ground is lower bone, this is, and R for radius. So lower radius is Galeazzi. This is how you need to remember the Galeazzi fracture, because these are very commonly asked bit in your PG entrance. So patient has history of fall on outstretched hand. So here we have two things as the a dorsal or a radial dislocation of ulna, and we have fracture of the distal diaphysis or middle diaphysis along with the styloid process of the ulna fracture. So how will you remember? As I told, it's a lateral bone which is radius, and at the ground level that is low. So how will you remember is ground, Galeazzi for ground, G for ground. Ground, so we have Galeazzi fracture. Ground is always lower when compared to the mountain. So it's a lower third. And along with the ground ka R is radius. So Galeazzi lower third radius along with the distal radio-ulnar joint. This is how you remember the Galeazzi fracture. Then history of injury will be there, swelling along the forearm, restricted elbow movement, restricted forearm and wrist movement. You need to, as I told you before, always include the wrist and elbow joint when you are taking the X-ray, because if you just concentrate over the fracture, we are likely to miss the radial head dislocation or ulnar dislocation at distal radio-ulnar joint. How will you treat this fracture? So as I told, we have two components here. One is fracture and second is distal radio-ulnar joint disruption. So distal radio-ulnar joint is a complex of its radius ulna. This is radius, this is ulna. This is ulnar collateral ligament. This is triangular fibrocartilage. So distal radio-ulnar joint, when it is injured, there is damage to the triangular fibrocartilage. So we can go for closed reduction, open reduction, TFCC repair, and If it's very damaged or patient is coming late, then you need to go for reconstruction by using tendon graft. Whereas in fracture, we can manage by close reduction or with cast nail, but adult, it always need open reduction and internal fixation. That is how you treat Galeazzi fracture. So you need to do something for the distal radial ulnar joint and you need to do something for the radius fracture. The complication here is malunion. There is persistent distal radial ulnar joint disruption and patient may develop stiffness sometimes. So this is all about Monteggia fracture and Galeazzi fracture. One common fracture which affects the forearm bone, isolated forearm, is nightstick fracture. So isolated ulnar fracture caused by direct blow to the forearm, as I described in the case in the first sitting. So here, if the patient is trying to resist the cob who is hitting him, if you see here is a cob hitting the forearm, so patient may likely to develop direct injury to the ulnar. So it's called as nightstick fracture. So it's always suspect a variation of Galeazzi or Monteggia or assist low lesion when patient has nightstick injury. Symptoms are pain, swelling, loss of forearm and hand function, gross deformity, and sometimes there will be open injury. So always take X-ray forearm, including radius and distal and proximal radial nodule. Here, if you see, there is a isolated fracture of ulnar with no disruption of radial nerve joint distally and proximally. So if very undisplaced fracture, we can manage conservatively. If it is displaced, then we can need to go for open reduction and internal fixation with either plate or nails. So here the complication is again the malunion and non-union is very common. So here I just want to brief what we have learned in the class so that you need to remember is we have learned Monteggia fracture, Galeazzi fracture, then we have nightstick fracture. So Monteggia, always remember mountain. Mountain means medial bone. M for mountain, M for medial. Medial bone is ulnar. Then mountain is always high. So upper third. So upper third, ulnar fracture, plus here we have proximal radial nerve joint dislocation. Radial nerve joint. So that is radial head is dislocated. Galeazzi, always remember ground. G for Galeazzi, ground. Ground is always lower. So lower third. Then we have R for radius. So it is combination of radius, lower third fracture along with distal radial nerve joint disruption. So here we have proximal radial nerve joint. Here we have distal radial joint. Nightstick is just isolated fracture of ulnars. But we have when we have a nightstick fracture in your clinic, always suspect the variation of Monteggia and Galeazzi before labeling it as nightstick fracture. This is all about today's class. So I request you again to like the video, share with your friends, and subscribe to the channel. And please leave comments when you see the video so that I can improve in next class. Thank you.